The human tongue is a remarkable organ. It's essential for speech, taste, and swallowing. Understanding its development helps in diagnosing and treating various conditions. It also aids in understanding speech and feeding disorders. The development of the tongue is a complex process that begins in the early weeks of embryonic life. It continues through fetal stages and even after birth. Each stage brings significant changes and milestones. These changes shape the tongue into a complex organ. The tongue develops from several embryonic structures. These include the pharyngeal arches and the floor of the primitive mouth. This process involves multiple tissue types, including the muscles, nerves, and specialized sensory cells. The development of tongue begins in the 4th week of embryonic development. The primitive mouth, or stomotium, is forming. The tongue develops from 2 main sources. The anterior 2/3 come from the first pharyngeal arch. The posterior third originates from the 2nd, 3rd, and 4th arches. These structures will fuse to form the anterior part of the tongue. The hypopharyngeal eminence forms the posterior third. Between weeks 4 and 8, the tongue undergoes rapid development. The lateral lingual swellings grow quickly. They overtake and fuse with the tuberculum impar. This fusion forms the anterior 2/3 of the tongue. Behind the tuberculum impar lies the foramen caecum, marking the origin site of the thyroid diverticulum, which later forms a significant part of the thyroid gland. Meanwhile, the hypobranchial eminence develops into the posterior third. A V-shaped groove called the terminal sulcus forms at the junction. This sulcus marks the boundary between the 2 parts of the tongue. It's visible even in the adult tongue. During this period, the tongue also begins to separate from the floor of the mouth. A U-shaped groove forms around the developing tongue. This is called the alveolingual groove. It will eventually separate the tongue from the dental arch. By the end of the 8th week, the basic shape of the tongue is established. However, it's still far from its final form. The next stages involve the development of muscles, nerves, and specialized structures. These will give the tongue its unique capabilities. The tongue's muscular development begins around the 6th week of embryonic life. Mesenchymal cells in the tongue start to differentiate into muscle fibers. This process continues well into the fetal period. The tongue muscles develop from different sources. The intrinsic muscles form from cells within the tongue itself. These include the superior longitudinal, inferior longitudinal, transverse, and vertical muscles. They give the tongue its flexibility and precise movements. The extrinsic muscles, on the other hand, develop from surrounding structures. These include the genioglossus, hyoglossus, styloglossus, and palatoglossus. They connect the tongue to other parts of the mouth and throat. They're responsible for larger movements of the tongue. As these muscles develop, they interweave in complex patterns. This gives the tongue its unique ability to change shape and position. It's this muscular complexity that allows for speech and efficient swallowing. The development of these muscles are very important for normal tongue function. The tongue surface is covered in small projections called papillae. There are 4 main types: filiform, fungiform, circumvallate, and foliate. Fungiform papillae contain taste buds, crucial for taste. Development is influenced by maternal nutrition, medications, and toxins. The tongue's complex functions require sophisticated neural control. This involves several cranial nerves. Their development play a vital role for normal tongue function. The process begins early in embryonic life and continues postnatally. The hypoglossal nerve, cranial nerve 12, is the main motor nerve. It innervates all the intrinsic and most extrinsic muscles of the tongue. This nerve begins to develop around the 4th week of gestation. It grows from the brainstem towards the developing tongue. The lingual nerve, a branch of the trigeminal nerve, cranial nerve 5, provides general sensation. It develops from the first pharyngeal arch. This nerve is responsible for touch, pain, and temperature sensation in the anterior 2/3 of the tongue. The glossopharyngeal nerve, cranial nerve 9, innervates the posterior third. It provides both sensory and taste information from this region. The chorda tympani, a branch of the facial nerve, cranial nerve 7, carries taste information from the anterior 2/3. These nerves develop from their respective pharyngeal arches. During early fetal development, the tongue grows rapidly, occupying much of the oronasal cavity before the palatal shelves elevate. At this stage, the mandible is retrognathic due to its position near the heart prominence, limiting its anterior growth. As the fetus develops further, the mandible shifts forward, allowing the tongue to descend and occupy a lower position within the oral cavity. This movement facilitates the elevation of the lateral palatal shelves, essential for the formation of the roof of the mouth. During the fetal period, the tongue continues to grow and refine its structure. This period is known for the maturation of muscles and nerves. It's also when the tongue starts to become functional. By the 14th week, the fetus begins to make sucking movements. This is an important milestone. It shows that the tongue muscles are developing coordination. These movements are crucial for successful feeding after birth. The taste buds continue to multiply and mature during this period. By the 15th week, they're structurally complete. However, their full functionality may not develop until later in gestation or even after birth. The fetal period is also when the tongue's size increases significantly. It grows in proportion to the rest of the oral cavity. This growth is important for proper speech development later in life. Any disruptions during this period can lead to various developmental abnormalities. The tongue's development doesn't stop at birth. It continues to undergo changes throughout infancy and childhood. These changes help it adapt to its new roles in feeding and later, speech. In newborns, the tongue is relatively large compared to the oral cavity. This helps with breastfeeding. The tongue's position is also more forward. This allows for a better seal during sucking. As the child grows, the tongue's size becomes more proportionate to the oral cavity. The number of taste buds actually decreases after birth. This might seem counterintuitive. However, it's part of the refinement of the taste system. Speech development brings new challenges for the tongue. It must learn complex movements for articulation. This process continues through early childhood. It requires the coordinated development of muscles, nerves, and the brain's speech centers. Despite the complexity of tongue development, most children are born with normal tongues. However, developmental abnormalities can occur. Understanding these is crucial for early diagnosis and treatment. Ankylosing or tongue tie is a common condition. It occurs when the lingual frenulum is too short or thick. This restricts tongue movement. It can affect feeding and later speech. The severity can vary widely. Mild cases may not require treatment. Severe cases may need surgical correction. Macroglossia refers to an abnormally large tongue. It can be congenital or acquired. Causes include certain genetic syndromes, tumors, or metabolic disorders. It can lead to difficulties with feeding, speech, and breathing. Treatment depends on the underlying cause and severity. Aglossia, the complete absence of the tongue, is extremely rare. It's usually associated with other congenital abnormalities. It poses significant challenges for feeding and speech. Early intervention and specialized care are crucial in these cases. The knowledge pertaining to the tongue's development helps in diagnosing and treating various conditions. It also aids in understanding the impact of developmental abnormalities and identify potential issues early. This is particularly important for feeding and speech development. Early intervention can make a significant difference in outcomes. The tongue plays a crucial role in dental development. Its size and position can affect tooth alignment and jaw growth. The significance of tongue in development of the dentition helps in planning treatment modalities. It also helps in diagnosing and treating speech disorders. Many speech issues have their roots in tongue development or function. Knowing the developmental stages can guide therapy approaches.